Hi everyone, my name is Joy and I'm a parent to a beautiful 7-month-old daughter who has spina bifida, and I decided to make this YouTube series alongside my TikToks that I've been making very not so often to educate, empower, and just talk about what it's like having a child with a different set of abilities. So I think this is going to be video one. We're going to talk about who I am, what is spina bifida, are you just getting the news? Let's talk about it. What was it like for us receiving our diagnosis news? And yeah, we can kind of go from there. Second video will be about like what we learned during our diagnosis time, what it was like getting the open fetal surgery option, the team at CHOP, and just feelings all around. So, cool. Let's just get into it. Who am I? I am a 30-year-old stay-at-home mom. I had fetal surgery at CHOP when I was 24 weeks pregnant, so that was in the middle of June. My daughter is 7 months old right now. She is sitting on her tummy time mat chewing a binky clip, and she's just the most kick-ass tiny little human being. She had an L4, L5 lesion, and it was repaired in utero. And we made it all the way to 37 weeks when they yoinked her out and snipped my tubes because I said, we don't need to have any more babies after this. I live in Philadelphia, so we're literally a half hour away from CHOP at any given moment, unless we're away from CHOP. And yeah, I consider myself like an alt mom. I mean, obviously you can see this giant thing dangling from my face. I have lots of house plants. I love riding my bike. I am active in the recovery scene. I have like 3.5 years sober. We've got dogs. I have a husband, and yeah, I don't really see parents who look like me too often in the like medical scene. So I figured that it might bring some people some comfort to see just like a little queerdo hanging out on the internet, raising their tiny human being. And what I'm not going to be doing is showing my tiny human being at all. She has the right to her privacy. She can't consent to being videotaped. So we're not going to do any kind of that like mommy vlog bullshit content. It's like, girl, get your bread, and I'm so happy for you, but it's definitely not my cup of tea. Cool. So, who am I not? I'm absolutely not a doctor. I'm not here to give you any sort of medical advice. Anything that I read, I love reading research papers, and I really enjoy reading as much as I can and connecting with her doctors and other parents who have children with spina bifida. And eventually I will make a resource list and put it available for people to see. Yeah, so let's get into it. What is spina bifida? I know that when I got pregnant, you hear these things like neural tube defect, but you don't really know what it is, right? Like there are different types of neural tube defects, and different types of defects that can affect the spinal cord, the brain, things like anencephaly, which is a pretty scary one. I had a list up earlier, some other ones where, things don't form right. But anyway, spina bifida, it's when the spinal cord doesn't form correctly. So not that it doesn't form correctly, the spine doesn't form correctly at a certain point. I've got a diagram. At least I did have a diagram. Bear with me. Hello again, it is me, and I have come back with a crudely drawn diagram on how to explain spina bifida to the average bear. And I'm also feeding my boob gremlin. You just want to be involved, don't you? I know. So what is spina bifida? Spina bifida is a neural tube defect. And where have you heard that term before? You've heard neural tube defect before because they talk about why it's so important to take prenatal vitamins, because a higher level of folate and taking vitamins with folate in them can help prevent neural tube defects. Let me tell you, if you're getting the diagnosis of spina bifida and you forgot to take your prenatal vitamins, this is not your fault. This is not your fault at all. I promise you, it's not your fault. There are moms who take their prenatal vitamins before they get pregnant, are in crazy amazing health, take their vitamins on the regular daily basis, eat really clean, and they still get kiddos with spina bifida. And so, like, don't blame yourself. You can't blame yourself. This is not a you thing. This is just oops, there's a lot of vertebrae in the body and something in my kid's DNA didn't get the message. There's like 144 genes that go into forming a spinal cord. That's a lot. So don't blame yourself, please. And I understand if you are, and it's going to be okay. I promise. Whatever consensus you come to with receiving this diagnosis, if you think you can handle it and you want to go through with it, fucking do it. But if you decide, hey, this is too much for me, I don't think that I'm going to be able to provide my child with a good quality of life or provide myself with a good quality of life, and you choose to terminate based on medical condition, that's also so okay. Like, it is so okay, whatever you choose to do. This is your life, and I'm not in the market for telling people what to do. Hell, if circumstances would have been different, I think I probably would have medically terminated. So I understand your feelings. And if you think that, damn, I can fucking do this, well then let's keep on talking, kiddo. What is spina bifida? That's where you've heard spina bifida, is because they tell you to take your prenatal vitamins. I'm going to tell you, I'm one of the people who did not take their prenatal vitamins, and our doctors were like, it's fine, it's not your fault. So, take your prenatal vitamins because your doctor tells you to, but it's not your fault if you forgot and you have a kid with spina bifida. Anyway, spina bifida is a neural tube defect, and basically, I'm trying to do this while the kids, your vertebrae is supposed to look like this. And when you have spina bifida, your vertebrae is like, oops, I forgot to close, and your spinal cord sticks out a bit from it. There's 3 different types of spina bifida. There is myelomeningocele, when the spinal cord sticks out completely and it's exposed to the amniotic fluid. There is meningocele, where there is a sac covering the spinal cord. And that sac can be filled, it can be a cyst, it can just be skin, it can be a lymphoma, whatever. Or you can have spina bifida occulta, and that's where it's hidden. You sometimes see like a little patch of fur on someone's back, or like a little cyst, but it's always typically behind the skin. It's just sticking out a teeny little bit. I have a girlfriend who has spina bifida occulta, and she didn't find out until she was, I think, like a teenager or early adulthood, when they took an x-ray of her spine. And she was like, oh, that's why I'm always constipated and my back hurts? Excellent. And I said, yeah, buddy. Anyway. So some common things that occur when you get the diagnosis of spina bifida is you will see a buildup of fluid inside the ventricles of the brain. See that blue part right there. I can't point to it because my hand is holding up my child's head, who's attached to my breast. And that is called ventromegaly, where you get an excess buildup of fluid inside the brain because your spinal cord system is supposed to have fluid that flows in a loop, and is supposed to flow up and down really, really smooth. But when your spinal cord is sticking out, it's kind of like developing a kink in a hose, and that fluid has a hard time going places. So that's why you'll see the buildup of fluid. And then because your body is trying to make that system, like the fluid, go up and down, the cerebellum gets pulled back, and it's like, come on, fluid, let's go, and it yanks on the cerebellum. So then it gets pulled into the back of the brain, which is called hindbrain herniation. as you can see right there. Or it can also be called Arnold-Chiari 2 malformation. Some kids develop hydrocephalus because of the struggle bus their spinal cord and the spinal fluid is on, which could cause, you might need a shunt. But yeah, so how does spina bifida work? What parts of the body does it affect? The spina bifida can affect a lot of parts of the body. Typically, it's from like the waist down that affects. Our spine is broken up into 4 different sections. You've got your like C1, C2, C3, that's like the very back of the head region. You've got your thoracic, you've got your lumbar, and you've got your S, which I think is sciatic, something like that. But anyway, depending on where your lesion is, that will affect the nerves from that body part down. For example, my child has an L4, L5 lesion. So that's going to affect the nerves or the dermatomes from here down. So for example, the L4, L5 is responsible for like the back of the thighs, the back of the calves, down to the toes, bit of the shin, and sometimes like the knee could be affected. And because there was that hiccup at L4, L5, it's also going to affect the nerves and the areas of the body from the S area down. So for example, my child has a neurogenic bowel, so she's constipated all the time. We don't really think that she can feel, she doesn't have the muscle tone to be able to push her poop out, because the sphincter is controlled by the S region. So the higher the level of the lesion, the different parts of the body will be affected. Does that make sense? Did I explain that good? Great, because if I had to explain it again, I'd probably not explain it very well again. Anyway, so kids with spina bifida can live long, happy lives. There's tons of people living with spina bifida. There's a musician, who is it? Is it Bruce Springsteen? It's not Bruce Springsteen. I have it on a Jeopardy question. It's not Willie Nelson. Look it up. There's a famous musician who has spina bifida. But the way that the spina bifida affects these different parts of the body they can have paralysis at those regions. For example, my child, she can't really move her middle toes and her pinky toes that well. She doesn't have much muscle tone in her butt region. And I was poking around with my tweezers, just poking really softly at her skin to see which parts of her body twitch when I touch them. One of her calves is sensitive, one of her calves is not sensitive. It's not a symmetrical thing. But some kids are wheelchair bound, and then they get like really cool wheels, and they get to be on the wheelchair basketball teams, which I think is nifty. Or they get like those souped up mountain bikes. And there's a ton of different resources for kids with spina bifida. Problems that children with spina bifida typically run into, as far as their concerns when they get older, are social problems, like having social continence, being able like not shit yourself while you're at school. That's a thing that people worry about. Finding providers as adults, because you get used to seeing the same doctors from the age of baby until you're 18 years old. Sexual dysfunction is a thing that children or people living with spina bifida have trouble with sometimes. And they also, accessibility can also be troublesome. So if you're a non-ambulatory person You might find it really challenging to live in, I don't know, El Paso, Texas, because there's no fucking sidewalks or trains and stuff. Or, you know, even I'm ambulatory and so is my child, but having a stroller and having to like lug that thing up and down the stairs when the train station says it's a handicap accessible station with an elevator, and then it turns out that the elevator is broken, that kind of thing can be challenging for kids. Another thing that we were told is our kid might be clumsy because she can't necessarily feel all the parts of her body. It's kind of like when, I think it's called let me see. Beep, 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 beep. Proprioception. Proprioception is when you can't feel your body part in space. For example, when your arm, like if you fall asleep on your elbow and then you can't feel your hand and you're like, oh my God, I'm never going to be able to feel my hand again. Sometimes kids feel that in their feet. So they are a bit clumsy. But clumsy, bad with sense of direction, ADHD, things like that. Those can be some balance. Those are some of the deficits that you might see with kids with spina bifida. They might need to be caffed. They might need to have enemas. There's a whole bunch of stuff. But like these kids are usually like your average bear. Like they're smart kids who can advocate for themselves in healthcare settings. And I just love my baby to bits. So I think that if you choose to have your baby with spina bifida, you're gonna love your baby to bits as well. So in the next video, we are gonna talk about how we got our diagnosis and all about the surgery and the different types of interventions we receive for our tiny human being. Her name is Wild. I'll start talking about her with her proper government name next time. So thank you so much if you made it to the end of this video. I hope that I helped you. And if I didn't and you're just like here because I'm pretty, thank you also. So farewell.